Now we
Welcome
go.
back to another episode of the Alex and Mo podcast. And tonight, Alex and I are so happy to have with us our first occupational therapist on the show. Is it?
I think she might be.
Yeah, welcome, Marissa.
Terrible.
I think she might be. It's been a minute,
Terrible.
so
Well, you know
apologies
what?
if we had anybody else who was an OT and we forgot about you. I really
So yes, so if
apologize.
we did, we apologize. We sincerely apologize. Okay. So we just celebrated World Occupational Therapy Day. So I know Occupational Therapy Month in the US is
April.
April.
I was gonna
So
say, dang, they don't even get a month.
yeah, no. They got a month,
We
but
got
this
a
is
whole
like
month.
World Occupational Therapy Day. So
Okay.
they just celebrated that a couple days. I think it was last week. So uh Marissa and all the OTs and coders, happy World Occupational Therapy Day, belated. All right. So and I'm sorry it took us so long to have an occupational therapist, but they usually say save the best for last. So Marissa, welcome, welcome to the show tonight.
Hello.
So we
So
did.
I'm Marissa. I'm an occupational therapist. I've been an occupational therapist for about 10 years now.
She's young.
Um,
She's young.
I know half the time you guys been.
But you're not only an occupational therapist, though.
Yes, I'm also a doula, which I've been a doula for about 3 years now, since the pandemic.
So what
And I
made you
made
get
that
into
shift.
occupational therapy versus physical therapy or speech therapy or any other type
So
of
first, I really
Mhm.
wanted to be a nurse.
Oh.
That's what happened. I went to school to be a nurse and I didn't get into the nursing program. So I made the shift and I got my bachelor's in pedology, which is the study of children and adolescents. So I was a preschool teacher for about a year. And then I was like, yeah, this is not it. I
Bless you.
had a class size of
Bless you.
20 people, 20 kids who were 2.5 to 3 years old.
Wow.
Like I
Yeah.
said,
But
bless
you
your
have the
heart.
personality for an elementary school teacher though.
Right. But you have to be like every day. And I didn't want to be like
See,
that every day.
I don't honestly like. I think there's more to it than just the personality. Like, it's a lot of like mental exhaustion
Mm-hmm.
that
Okay.
that comes from it. I mean, obviously, as a dad, I've had it in short phases, but I had,
Mm-hmm.
at any given moment two, right? Because I got
Mm-hmm.
two boys. When you're in teaching, you've got
Yep.
15 plus kids, different personalities,
Mm-hmm.
different needs, and you're
You
trying
have to
to,
learn how to pivot a
yeah,
lot.
you're trying to do that. My wife is helping out at the kids' school, so she helps the kindergarten teachers, and
Mm-hmm.
it's been in a change for her because it's it's different going from, again, two kids to 15, 20 kids and
Yep.
learning their mannerisms, their personalities, and how that is. So salute to all of our teachers, because
Yep.
that's a lot of work, man. It's a lot
Because
of
you're
work.
teaching
So
them
this was a
potty
career change for you.
training. You're teaching them potty training. Also, like you have this lesson plan. You're like, okay, we're gonna do this today, and the kids is like, yeah, no, we don't want to do that. So you have to really learn how to pivot and be open to whatever's coming up.
And for that reason, it was one of the reasons why I knew that I did not want to do pediatrics therapy,
Mm-hmm.
right? Because going through PT school, when on one of my peds rotations, I was like, yeah, no, like I'm not, I don't want to play, right? I don't have the mentality to figure out what I'm trying to do from a therapy standpoint while making it fun, while getting them to engage. Like,
Mm-hmm.
and there's
Mm-hmm.
obviously some amazing pediatric therapists out there. And I think that's the biggest difference, right? Like, we all know rehab, we all know therapy, we know those things, but it's how to connect with the kids and how to make that change for them. So again, kudos to all of our teachers.
Right.
So keep
So
going. You
you were
started
a teacher
PD.
and you did what? What happened
So I was
after?
a teacher. That
Uh-huh.
was a year, and then I was like, yeah, I got to do something else. So I watched this documentary on, I think it was like TLC, and it was conjoined twins who got separated. And during the surgery, one of them lost oxygen and needed PT and OT. So
Mm.
I was like, oh, I could do this. So I thought about PT, but my mother's friend, who is a professor at Seton Hall, was like, "No, you should do OT." So I looked into that and applied to OT school. Applied to one
Dang.
school, got
We,
Wait,
in,
wait, wait,
and
wait, 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 wait.
here.
we gonna have to
Let's
have a
touch back on that. Yeah,
we
rewind,
gonna have to
rewind.
have the Seton Hall
So,
professor on the show.
yeah,
I want to know what.
why not PT? Why not PT?
Because I like so much, as far as OT, you can do so much more with it, I feel like, in different settings. So it was like, yeah, I want to do that.
But was that the reason the professor gave you?
She had me look at a whole bunch of different things. So she didn't
Mm.
just like, here, you should do this. She was like, here, do some research and see if you still want to do physical therapy.
Mm. Okay.
Okay.
So one of the biggest things that people complain about is the lack of return on investment for physical therapy. Do you
Okay.
see that as the same problem with occupational therapy now being 10 years into it?
No, because I think people just don't look at all the different settings and different things you can do with it.
Okay.
So
So we'll have you touch on that too.
yeah, well, I want to hit on that because, admittedly, very naive or can't think of the right word right now. But when people tell me OT, in my head, I think of two, maybe three settings.
Hmm.
Right? You're making it seem like there's a plethora of opportunities, which there may be. But like
Hmm.
for me, OT is acute care.
Hmm.
Well, now more,
Cool.
but like I think like acute care, rehab, sniff type is one, a school setting,
Hmm.
or home health,
Hmm.
right?
Or
Because it's not
outpatient.
common. Or but see, around, at least around me, like it's not common to find an OT in the outpatient setting. Unless
Okay.
you're unless you're talking about a hospital-based outpatient clinic. But
Gotcha.
like your freestanding outpatient clinics, like you're not really finding much OT. So
Gotcha.
tell me about all the different opportunities, because for somebody who's watching and may be, in between, like, hey, do I want to do physical therapy? Do I want to do occupational therapy? Like, what is out there for them?
Well, there's also pelvic floor therapy, which
Oh boy.
I really didn't know much about pelvic floor therapy. I just thought, oh, you just went there because you had like bladder, bowel incontinence, or what was the other thing? Basically that's all I thought of. But actually, you should go there if you are pregnant or after you're having a baby, because different positions that you gave birth in can mess up your whole alignment. And you might be having pain in your tailbone and you can't sleep on your back anymore just after having a baby. And that's because of the way that the position you was in when you pushed out the baby. So just different things like that. Or if you have IBS, you can go to pelvic floor therapists or people who are changing their gender, just different things like that. Or prolapse. So yeah.
So what would be different in from an occupational therapist point of view, compared to a physical therapist point of view, as far as pelvic therapy? Like, is there a difference? Is there
I feel
a
like our practice framework and using a holistic approach, as far as thinking into having sex and different things, that's an occupation that people don't really think about, but have that relationship with your partner that now you're going to have issues because you have these issues with pelvic health.
So, did your interest in pelvic health, is that what led into the
Mhm.
doula interest, or how did that come about?
The doula interest came first, and then I started learning more about it because those are some of the resources that we have to like refer you to pelvic floor. And then also now some hospitals are going to be recommending you going to pelvic floor therapy after giving birth because that's how important it is. So that's kind of what led me into doula work. But I also wanted to always be a midwife, so it kind of goes hand in hand in that. But to go back on to what other things that OTs can do, there's some people that are becoming realtors and who are also an occupational therapist. So they're selling houses to people who have disabilities that they can better, equip them to what type of house they need to buy so they can live there longer. Also having the CAP certification aging in place. as you're growing older, and most of the people now want to stay as long as possible at home, doing the modifications and helping them do that to be successful.
So can PTs get CAP certified?
Hmm.
Okay. Didn't know that.
However, some of the some of the programs want
Uh-huh.
only an occupational therapist on site handling everything and not a physical therapist.
I mean, we
Some
know
of the
about home
HUD
modifications,
programs,
recommendations.
some of the HUD programs only want an occupational therapist on site to handle the whole project instead of a physical therapist,
Based on what?
based on that's what they want.
Ah, I think now I know why you waited so long to have an OT on the show.
Man. So all right, so you went to occupational therapy school and you
Yes.
got your degree. Why home health?
So I worked in all different settings.
Mhm.
Of course, I did the hospitals. I've actually did peds as well. I didn't really like peds, and it's not because of the kids; it's because of the parents. That they had unrealistic goals for their kids. That was one of the things. Home health, I like because it's flexible.
Okay.
So you mentioned like
Of
with
course, the money
peds,
too.
um, the dealing with the parents. I feel like
Mhm.
when you start dealing, and sometimes in home health, like you start dealing with the older population, we run
Mhm.
into some of the same issues because now
All
instead
right.
of parents, we've got kids, siblings,
Mm-hmm.
whatever the case may be, wanting to impose their beliefs onto what the patient should be or shouldn't be doing, or even trying to tell us how we should be doing our job or what we need to be doing. So how have you managed that? Because I mean, obviously Mo's home health, myself, we're home health clinicians. So we've experienced this, we see that.
Mm-hmm.
How have you been able to navigate that?
So yeah, definitely the family dynamics is a big thing in home health, especially with seeing the conditions that the houses are in, learning more about the patient because it's like, okay, how did it get this bad? Or, they want mom who's 93 years old to be independent again, which she has dementia. It's like, this is really not going to happen anymore. So really just providing resources for them. Also breaking down their diagnosis to family to have them understand what is actually what's going on and if these goals are really realistic for them.
Now, a huge part of occupational, because I literally spent 30 minutes with a patient today, because he was gonna decline OT, and I had to let him know the benefit of it because, dude, you're gonna need it. He has a hospital bed, a bedside commode, walker, wheelchair, everything, and he's trying to turn down OT. But there's a cognitive part to occupational therapy as well too.
Mm-hmm.
So how do you approach that when you're in a situation where you have a patient who was independent just prior to going to the hospital and now they're totally dependent, living with an elderly spouse? Like, how do you approach like an assessment or evaluation like that?
I feel like I break it down to like, okay, what is your main goal? Yes, you want to be independent again, but what is the steps to get there? As far as everybody, you always go in, they want PT because they want to walk, but they can't put their sock on, they can't wipe their butt, like they can't shower well. That they don't think about none of those factors. Just I want to walk. Okay. So really breaking down like, okay, can you do this? Can you do that? Can you cook? Can you do this? And they're like, no. Oh, then you need OT.
So how can physical therapists be better, especially home health physical therapists, be better at selling
Not just say that we
occupational
work on
therapy?
upper body strengthening.
I like to throw in fine motor.
Well, that's good. I'm glad you throw that in because other people don't. They just be like, oh, yeah, they just work on upper body strengthening. That's it. Instead of thinking about the functional factors that we tie into as far as laundry, cooking, cleaning, moving around the house, being able to do their meal, budgeting their money again.
Okay.
All of those are factors that you need to be able to live successful.
What about caregiver training and recommendations? Where do you
Also
guys
that,
fall into
and
that?
also equipment in the bathroom.
Okay.
If it's a proper shower chair, just different things that they can do to adapt their house to make it easy for them.
But Marissa, it's a big difference working with geriatric clients and going to deliver newborns. It's like you're just going through the whole spectrum.
It is. It really is. Well, I even think preschool kind of helped me gear for home health because dealing with little kids is kind of still dealing with people who have dementia. I
Well,
did potty training for 3-year-olds. Now I'm doing potty training for grown adults. So it's almost the same training. But as far as tying the doula in, it's all about family dynamics as well because you're changing your family. You're adding additional player into the team. And then also the communication you have with your partner, or if you're doing it by yourself and relying on your resources that you have out here in the community.
someone also said med management. Yes, that's huge. So,
Y'all
um,
can have that. Y'all can have that. Excuse all my PTs that I'm not at the top of my license, but I ain't trying to do all of that all the time.
Yep, medication
Yeah.
management, that is a really big thing too. So just not just saying, oh yeah, they just work on upper body.
No, man, it's fine motor too. Fine motor.
Mm-hmm. Mm-hmm.
out
So
of sight.
the birth support aspect.
Mm-hmm.
How did you A, like what was your interest in that? And then B, how did you mold that to be a part of, what you do? Is that something you do private, or does that go through insurance, or how does that work?
Currently, I do it private. I'm with another agency that provides, the clients to me. And as a doula, we offer 2 prenatal appointments where we go to your house and talk about like your birth plan, how you want your birth to look like. Do you want a calm and warming environment? Do you want it quiet? Just what it looks like. Some people, their biggest thing is they just want to feel heard. They want to feel safe. They want to live. Those are the biggest things. Because as a Black woman, we have the highest maternity um, mortality rate out of anybody else. So they just want to live. The biggest thing. So that's one of the reasons why I became a doula, just to advocate for people.
So you're more like a boot coach, basically.
In a way, we're providing emotional and physical support through the birthing process. So yes, adding advocating for them while they can't advocate for themselves, while they're in pain or going through the whole motions. Even discussing different questions they might have for the doctors that they felt rushed through in their appointment. And what signs and symptoms they should look for while they're pregnant and even after delivering the baby.
Okay. And do you find that a lot of people find it challenging to pay cash for this type of service?
No, not really, because a lot of people are waiting in life to have babies. So they are, properly saving, but also having people add that to their registry instead of getting, all these diaper warmers or white warmers or the expensive stroller, add in doula service because you can also have a postpartum doula. So when you return home from the hospital, and you might want someone to be there for a couple hours while you get some rest or just the support or talk about breastfeeding and help you latch, different things like that.
I'm curious. Does having a doula, has there been any study saying that having a doula service helps to reduce like postpartum depression or anything like that?
Not really having that, but more of maybe increasing, delaying as far as shortening the time of having a baby. I would say
Mhm.
that during the delivery. So instead of being there for 24 hours, you might be there for
Mhm.
12 because we went over different positionings to have. So that's where OT also plays an effect in to a lot of women have carpal tunnel during pregnancy. So working on that and doing different braces, different exercises and hand exercises with them. And then different positions you can do to deliver the baby or when you're going through pain. Also, when you're breastfeeding, positioning is very important because you can be hunched over, you have back issues, holding the baby, all of that. So posture alignment.
So are
Why
you
the increase in carpal tunnel? I'm curious.
I don't really know.
are you guys present at the time that the birth is
Hmm.
ongoing?
Hmm.
Okay.
Yep.
So but at that time you're in your main title is doula, right? It's not the OT part or
Yeah, I'm a doula.
okay. You just have the added
I'm a certified birth doula.
so you have the added knowledge of the OT, which obviously you can kind of package together, so to speak,
Mm-hmm.
to just
Mm-hmm.
give a better overall product to your clients, right? Because now, like you said, you can address not only their birthing needs and going over that education, but also the education that you have as an occupational therapy.
Mm-hmm.
And how does that what has been the reception of your clients when not only do you introduce yourself as Marissa, doula, but also occupational therapist?
Well, some people don't know what occupational therapy is, so they're not like, "Oh, great!" And then some do because their grandmother had occupational therapy when she had a stroke years ago. So, just breaking down and having the knowledge of sort of a medical background, especially if someone is hypertension or having diabetes or different things like that, I can label that.
And what has been the doctor's reception towards you, I mean, your background and stuff
They
like
just
that?
think it's pretty cool.
Yeah, it is pretty cool. We're seeing a huge increase in physical therapists getting into pelvic um, floor health,
Mhm. Mhm.
both men and women. So I know prior to us going live, we were having the debate about PTs encroaching on OTs with that territory. So is this something that's taught in school during while you're OT?
So I know when I was in school, we did not talk about pelvic health at all. But they are going now to the schools and adding that in. Some are trying to fight to add a class and not just like a session about pelvic health.
Mo,
Okay.
did you get
I
pelvic health in PT school?
Not that I can remember. But Alex, I'll be honest, there are a lot of times I wasn't paying attention. Yes, I'm confessing it. But no, we did not.
I think I vaguely remember like a lesson on it.
Mhm.
I don't think we went into too much in there, but we had in my PT school probably at least in our area one of the first therapists who had their women's health educate like certification and ongoing stuff with that. So but I think that was after I had graduated and then I had when I was back on as faculty at that point. But yeah, like we didn't get much of that in PT school.
Mhm.
So to see now the amount of interest in that particular area is pretty cool for both men and women. I mean, we've had um, guests on here who did the
Adam,
men, yeah, did
yeah.
men's pelvic health out in New York,
Mhm.
and
Mhm.
he's doing pretty well with that. So it's definitely one of those areas now that is starting to kind of gain some traction, momentum,
Mhm.
popularity, whatever word
I
you want to
just
use.
did a went to a conference and it was OT and pelvic health, which I thought was pretty cool because I always see pelvic floor conferences and stuff, but of course it's PT based. So for this one, it was about 100 OTs in Arizona. It was a 2-day course and it was really good. And it was all different ages. I would say people who just got their degree and are trying to go into pelvic health or starting to practice, or people who's been in it for like 20 years. And then just focusing on different parts of pelvic health was pretty cool.
I like how you've thought outside the box and you're doing something additional to bring value to other people and to yourself. I think a
Mm-hmm.
lot of us as clinicians limit ourselves,
Mm-hmm.
and not think that we can use our degree to do something else. So this is pretty good. Did you feel apprehensive at first, getting into it?
I did, because I feel like all doulas that I knew or know, they had children before. So I was like, oh, no one's gonna listen to me because I have no kids. So how am I gonna be a doula? But it works out.
What's up? Well, you have to know the unique value that you bring to something. So just work with that.
Yes, it's working out.
It's working out.
And then also, I think I also got stuck in a rut and like bored with just doing home health, especially during the pandemic, because it was nonstop. There was no break or anything. So I was like, I think I want to do something different, and that's what happened.
So we have a lot of physical therapists complaining about burnout. Do you
Mm-hmm.
have you ever felt that doing home health, or
Mm-hmm.
do you hear your other colleagues complain about it?
Mm-hmm.
Yep.
Yep.
So so
That's why I
was
take
it
trips.
Alex, you see you see how they have so much flexibility?
Oh yeah, yeah.
I take trips.
You take trips. Well, that's good. That's good though. But how important was it for you to diversify? It obviously helped you avoid the burnout issue or being bored in just one setting. And it seems to be something that you always been passionate about, because you said you were considered being a midwife,
Mm-hmm.
and this was something that you were naturally inclined to do. So um how how important is it you being in that role, for especially in you're in Maryland, so for the people
Mm-hmm.
who don't know, and you're in Prince George's County, Maryland, which has a pretty large population of Black and brown individuals.
Mm-hmm.
So how important is it for you to be a representative of those women who experience high maternal mortality and being marginalized?
Um, I thought it was very important, just like hearing it all the time, the rates of, Black women dying, you seeing it all the time in the news or even watching the show, that it was just like, oh, I really feel like I'm needed. And if, you can't save them all, but at least if you're able to save one or two, like you at least did your job, I feel. So just being open and a listening ear and advocating was very important.
So I was at a legislative meeting a few weeks ago, and I found out that in Prince George's County, there's no hospital where a woman can deliver a baby. They have to travel to another county. So where do you offer your
So actually, you have the one in Largo. What's the new one? University of
University of Maryland?
Maryland, Capital
So
Region. I've had clients that delivered there.
okay, so that's recently built, but prior to that,
Mhm. Mhm.
that was one of the biggest complaints, that they had to go to other counties to deliver
Yeah,
their
I have a lot
babies.
of
So
clients that go to Virginia. They go to Inova or Virginia Hospital Center. You get people that go to Sibley or what's the other one? Sibley or Holy Cross.
oh, Holy Cross. Okay.
How
All right.
big is that county you're talking about, Mo?
It's
It's
huge.
big.
It's huge.
So you're talking about a huge county, and they have to go to another county to be
Yep.
able to deliver.
Mhm.
Up
Yep.
until this
Mhm.
last hospital was built.
Yes. And this was recent. I think it was built in the past, what, 3 years?
Mhm.
Yeah.
Mhm.
Yeah.
It seems
But
pretty
not a lot of
wild.
people delivering there.
So it's a big county, but people just naturally choose to go outside of the county regardless.
There was none available, so they did not have a choice but to go to Virginia or Montgomery County,
Mhm.
which is the sort of a next county over. Virginia is another state over.
So like,
However, it's really not that far.
that's what I was gonna say. Like, how far are you from Virginia though? Like, yeah, it's another
Like
state.
I'm
but-
Well,
35 minutes
not in
away
Virginia, but I'm
from a
about
lot
20,
of the
25
Virginia.
minutes. Yeah.
Yeah, I'm like 35 minutes away from a lot of the Virginia hospitals, so it's not bad.
I mean, for perspective, like the hospital that my wife delivered both of my boys, I mean, it's a at least 30 to 45-minute drive.
I understand that, Alex. But if people want to Google, they would see that the highest density of quote unquote wealthy African Americans reside in Prince George's County.
Mm-hmm.
It's one of the top areas for Black and brown individuals who live in the country. But a lot of the resources are scarce, like having to go do a maternal delivery or even the school system. It's
Some people
not
also
the best.
just like the care of some, physicians, and they're not here. They're in Virginia or at Sibley, or I know like some of the hospitals have a higher chance of a C-section rate, so people are not going to go there if that's the case because they want to have a vaginal birth.
So, which leads to the health disparity issue that we have here in this county that
Mhm.
charges a lot of high taxes.
Mhm.
But so you just said that the county that we're referencing, Prince George County,
Prince
correct?
George's County, yeah.
So highest,
Per
it's a
capita.
wealthy minority population. Is that correct?
Mhm.
Per capita.
Yes.
Per capita.
So, I mean, isn't it reasonable to think that most of the people that have the means are willing to
Travel.
go further or go be more specific with where they get their care?
They can be, but what I am trying to get to is that for the amount we're paying in taxes,
We should have
and
something.
we deserve the same
I heard
type of
it's
policy that
coming.
people are migrating.
So then
I heard
again,
it's coming. There's a hospital that it's coming. There's a hospital that's already here, but they are changing over a whole bunch of stuff, so it's coming.
I mean, it leads the question to,
Uh-huh.
kind of since we're in the election mode, right? Like all these questions
boy.
about taxes and stuff get thrown around. Like, so what are your taxes doing then? Right? Because when people say like, hey, like I don't want to play, like for instance, I'll give you an example. Here in Florida, specifically in Hillsborough County, which is where I live, on the ballot we have where they're trying to basically raise the mileage on property taxes, which is how they calculate property taxes, but for the school system, right? Because they want to generate more money for the schools. So if that's where your taxes are supposed to be going, right? But you're telling me like you guys pay a lot of taxes. I mean, that county pays a lot of taxes, but there's no hospital. So where the heck is the money? Like, what
No,
are they doing?
there are hospitals, but for maternal delivery, it's recent.
Seems
It's new.
wild to me. Like that, I feel like that should be a question asked to whoever is the head of that. We're like, yo, why are we getting this? Because if you have a population that is well off or better, has more resources available to them financially,
Mm-hmm.
you got to believe that those people are just as equally looking to expand their families. So even though they may want to or have the means to drive, right? Like they still should have those services available to them in a much more local manner.
And the truth is, a lot of the people who reside in Prince George's County are heavily federal workers. So
Mm-hmm.
some may work in DC, some may also work in Northern Virginia. So
Okay.
they go where they know the best care is. Like I had to have major surgery 2 years ago. I went to Virginia. I went to doctors in Virginia because that's where the best doctors were for that particular condition. So it just depends. And
So
it was like a
Marissa,
40-minute drive.
So all of your clients, we said, are private pay, right?
Yes.
Do you guys do any pro
Not
bono?
all. A lot of insurances are now starting to pay for doulas as well.
Mm.
Okay. Do you or the company that you affiliate with or whatever that setup is there pro bono services? Like is there no. Okay. So basically this is a service that as right now, if it's not covered by insurance and you don't have the means, then there is no access to it. Correct?
Hmm.
Okay.
Actually, there are some programs that are starting to like open up to people who don't have the means of paying for one. Um, but you probably won't get. I know I have a coworker that is starting to set that up, but you won't get the prenatal visits. You kind of just have a doula that will come to the hospital the day of delivery.
Okay. And on that route, what's the benefit to that as opposed to not having one?
So just having a supportive person that help guide you through the process because okay, the day of delivery, the doctor comes in like every 4 hours to see what's going on. The other person will be the nurse that comes in and out just to check how you're doing. But the most of the time you're like by yourself, either with your spouse or your mother, whoever is there with you. So you don't really know what to do, how to feel. You're nervous, you're scared because this might be your first child. So having a doula there to help you through that process and different positionings that you can do, just talking or having a dance party, whatever the case may be.
Now, do you guys have any kind of legal power to advocate for the client, or you just kind of like a bystander and kind of do whatever? Like, do you
So I
understand
wouldn't
what I'm
say
trying to ask?
illegal, but I mean, as far as like they hired me to to advocate for them, or more of okay, this is happening. Can we give us a minute to discuss so we can go over what's going on, and then they can voice their opinion after the situation.
And
Okay.
you don't get pushback from the physicians?
Sometimes you do,
Okay.
I would assume so.
because of course you're questioning somebody's, what they're doing.
Okay.
However, some of the stuff that they're doing is not right. It's more like we're rushing you during this process instead of letting your body really react to what's happening.
Now,
Okay.
the prenatal visits that you offer,
Hmm.
is that just you and the client, or do you ever go with them to
Nope,
their
it's just
doctor?
me and the client.
You don't ever go to one with the doctor.
Nope,
Okay.
nope. So the only time I'm interacting with that doctor is during the
The
whole
delivery.
delivery. And then
Okay.
sometimes you don't even have your own doctor that is delivering. So that's another piece that you're feeling you don't feel trusted or you don't feel put together or anything because you don't know who this doctor is and they're coming to deliver your baby.
So on that note, and I can only speak from my experience when my wife had my two kids, like so we had the OB that she primarily dealt with, but
Hmm.
part of this practice's policy, for lack of a better word, is we had to see, or we would
Everyone.
have the opportunity to see every doctor because, again, we don't know.
Hmm.
It was definitely the case with both my boys. Like it wasn't planned. Like things happened a lot sooner than we anticipated. So you're
Right.
just kind of whoever the doctor is that's on call for that particular group. Is that kind
Exactly.
of the way it is over? Okay.
Yep, it's the same. So you might have four doctors that you cycle through. Two of them you might not be feeling, but that one is there to help deliver your baby. So having one consistent person with you and that's your doula makes you feel a little bit, relaxed and not uneased about the situation.
So Alex just mentioned that his sons came early, well,
Mm-hmm.
rushed or unexpectedly. So do you have to be on call as a doula because things
Mm-hmm.
can happen?
Mm-hmm. People go in labor at 2 o'clock in the morning. So yes.
So hold on. So
I
how you
like my
taking all
sleep. I like my
these
sleep.
trips? Are you planning your trips
You
around
gotta
births?
decide. I mean, that month you probably don't have a birth, but no, you definitely had to. You are on call, so 2 o'clock in the morning, you get a call and be like, "Hey, my water just broke." I'm like, "Okay, okay."
Now, is that factored into the financial setup of all of this, or is that like extra, or how does that work?
So it factored in because the clients get about 14 to 16 hours of me being present with them. So they could have their water break, or hey, they're starting their labor and they want to labor at home as long as possible. So we might be communicating via FaceTime or on the phone, or even me just going up to their house for like an hour to discuss different things that they can be doing during this early stage of labor. And then they can get to the hospital. Some people want you there as soon as they get there, just to, feel ease. And then some people will let me and my partner go through this a little bit, and then we'll call for you when, hey, we're 6 centimeters dilated. Because you can get to the hospital and you're only like 1 or 2. Um, so that we will be there for a very long time. So after the 14, 16 hours, you will be paying extra. So it all depends on what you are trying to.
So, has there ever been a scenario when you're like, "Hey, we about to go over. What we doing here?"
No, no, it's more them. Hey, but I've been at a birth for like 23 hours.
That's a whole day, Marissa.
It is.
Like
It
you didn't
is.
sleep at all?
I mean, you go in and out of sleep, but not no sleep, Alex. I didn't.
Oh, listen, my wife will tell you like I was
But you
sleep
see, you
sleep.
don't have that in home health. You could sleep.
And then that's the thing. You have the partner over there on the on the couch snoring,
I'm
and you and your doula are just thugging it out, like
no man, like
because your wife is in pain, but
I
you
was I was
snoring.
sleep. Um,
Oh
and then
yeah, there's
and then
there's
the
been
run the
plenty of
running
times.
the running joke is like we're in the room and my oldest was born in April,
Uh-huh.
which I'm a golf fan. I play golf, so that was like right around the Masters. So she's doing, going through her process, and I just got the Masters on
On
the
TV.
TV
Yep.
in the room, and after where she's like, "You had the Masters on? Like this is what?"
While she's in pain, trying to
Yeah, she's over there
focus, needing a
struggling. I'm
back
here watching the
rub.
Masters laying up on the recliner,
Yep.
and
Mm-hmm.
but
You
We
almost
get
went
that
into
all the
the
time.
doghouse, Alex.
oh, she won't
so
let me live
so
that one
that's
down.
where
But
the family dynamics plays a part in that as well.
oh man.
I bet he did make that mistake again when the second one was getting ready to be.
Look, the second one was the day of the Champions League final.
Oh my
See?
God, Alex.
Like, but again, my kids, both of them came kind of fast, so we weren't
Mm.
planning for this. So we just had to go.
Mm-hmm.
And the doctor was like, "Hey, it's happening right now." We're like, "What?" They're
Mm-hmm.
like, "Yeah, we got to do this now." So yeah, like it's just what happens. But that one I didn't really have a chance to do a whole lot of relaxing because that one was it was just like let's get it and go. So
Mm-hmm. But sometimes I can plan because first time moms normally have the early stage of labor, which it kind of prolongs. So it can kind of get a feel like, okay, it's coming within a couple of days.
Okay.
And then some no. They just think they're still having Braxton Hicks. I'm like, no, you've been having contractions all night. Why don't you call me?
so how much of your practice is OT and how much of it is doula and birth related stuff?
um, I would say probably like 45%.
Is
Because having a baby is a job. So, and how we look at OT, those are all jobs. But yeah, I would say about 45%
45% for the doula
of
birth
OT
support.
being in doula.
Okay.
but like of yours, what do you do more, OT or you do more doula stuff?
Oh, of my life, I do more OT.
Okay.
I have like 2 births a month.
Now, the 2 births a month, is that like part-time, full-time? Like, what does that translate to?
PRN.
Okay. Have you ever thought of
So
doing more?
what does a full time birth schedule look like?
I think they have like 5 births a
Oh,
month.
well, two is part time.
Cause it's a lot because you really don't know when these babies are coming. So you can't be like, oh, you got 5 births in a month. Two might be early, and then the other three might be late. So you just don't know. So no, I couldn't do full time doing it's a lot. For your mental health, it's not good, I feel.
Okay.
Well, and
So
then I would
you
imagine, to her point about like being on call. Could you imagine if you got 5 different moms
Yep.
that you're on call at any given moment?
And you
Like,
gotta sleep, you gotta drive, you gotta be safe. So yes. In your
but
mental health, because
but
it
there,
takes a lot out of you just being supportive person, and you're doing counter pressure points to people while they're going through labor and having the pain. So just taking all of that, and you've been doing this for 24 hours being up, it's a lot.
Marissa, you're like a walking Swiss knife. You have all these different techniques to to work with patients.
Yep. Yep.
Like I
it's like
didn't
Mary.
even
She got like that Mary Poppins bag. Just
I
pull
know.
stuff.
Right.
But it's good to know. Because a lot of people think that just having the degree limits them just doing like home health or working in acute care setting or sniff, but this is really good information.
Hmm.
Um
I
I
follow like a lot of different people on Instagram that are OTs, but they're also like a lactation consultant, which that goes into feeding. So, and
Alex,
the
what have we
whole
been doing?
reflexes, right? And the whole
Look,
reflexes and sucking and all of that. So
I can
it
tell
falls
you
into,
that the breastfeeding, not because obviously I was a very supportive husband. That is another. It's a whole different world,
yep,
Oh yeah.
and like
it's a job.
there's this, what I believe to be, pressure from, it could be outside, it could be from inside, to try to breastfeed and to try to do these things. And man, that is taxing on a
Hmm.
woman's body. Um, and if you don't have the right support, or even somebody who kind of knows to guide you, like, you can end up in a real bad place with that. I mean, we were very fortunate that,
Hmm.
um, although it wasn't covered by our insurance, we were in a position to be able to have somebody help with both my boys, because we were just out there, middle of the ocean, with like a little flashlight, trying to figure out what it is that we're doing, right? So
Right. And
it,
then
it
the other part of that, if you've been breastfeeding for a while, like maybe even a year or two, weaning off of that also interrupts your pelvic floor. So going to a pelvic, yep, going to a pelvic floor
I probably didn't
therapist.
study anatomy well.
So yeah, so even just weaning off of it, of as far as it being emotional, but it also affects your body physically that you don't think about. Um,
Hmm.
so having the resources and support for that.
So doula, lactation coach, what else is out? What are the other options out there? I mean, I need to know. I mean, we got to diversify, right, Alex?
I I mean, we might have to take that on
You can be
as
a
another
realtor, like I said, that you
as
can
Well,
another.
help.
Alex is already a realtor.
So
So,
See?
I still have my license. I haven't done it,
But did
probably a
you
couple.
ever merge the two, you know?
Honestly, I didn't like,
See?
when I did it, it was purely just from a business,
Mm-hmm.
um kind of standpoint. For me, I never really had the idea or the desire, if I'm being honest, to want to merge them both. But it's a huge thing, right? Because one of the other things that I've seen, on social media and like Facebook groups and stuff, is like travel agents who are, obviously they have a therapy background, be it OT or PT, but they're travel agents for this population that needs these adaptive qualities, whether they're going to a hotel, a cruise, flying, whatever the case may be, right? So there's definitely areas where there's opportunity to do some of these things. I think, for most people, you just have to be able to think outside the box, right? Like
Right.
it's
Right.
very easy to get up every morning. I'm just going to go be an OT. I'm going to go be a PT, right? And you stay in your lane. And for some people, that's fine, right? Like that's more than enough for what they need to be able to provide for themselves and their family. And that's great for them. There's other people that they want more, they need more, right? So these are the people that start to think outside of the box or figure out, how can I diversify, how can I expand and do those things. And then that's where these opportunities present themselves, right? For that go-getter, that entrepreneur, those kinds of people that just kind of want to make their own path.
So can quotas become like do some of these things that you're talking about as well too, or is it just limited to OTs?
No, Coda can do it because they're all different certifications, so anyone could do it.
Anyone, including PTs? Don't.
Yes, anyone, including PTs.
Look, y'all are practically neighbors, so Mo's about to set up shop. Watch.
Oh no!
She doesn't need nothing else.
She's right.
Nothing else.
Mo's going worldwide over in Maryland.
Nothing else.
Prince George County taking over.
No. I'm good. I'm good.
And OTs can also do driving rehab. I don't know if anybody knew about that.
So she was telling me about that recently. I was
about
like, what?
Driving rehab?
Yes.
What is that?
So when someone has a disability or illness and they're getting back onto the road.
So is that making adaptations to the vehicle?
Correct. That, but also seeing how they're doing driving. So that we did have that in occupational therapy school. We did have, I think it was like a day or session or something like that. But we also rode in different vehicles that had the adaptations to the steering wheels or to the brakes and different things like that.
The only time I've ever seen that done is through the VA. One of my last clinical rotations in school was at the James A. Haley VA here in Tampa. And I did was in the spinal cord unit. So that's where they made those adaptations. So like some of these veterans, and thank you to them, I mean, they've more than paid their dues. But they would have these like normal cars, right? Like F-150s, Chargers,
right?
Like the nice cars that we all kind of think like, oh, that's a cool car. But they would get in it and it was like totally for them. But you would never know, right? Like you look at it from the outside.
It looks the same on outside.
It all looks the same, but you open the door and it's got all these different things for them to be able to get in, get out, sit,
get their wheelchair in and everything.
Exactly. If they don't have any function in their lower extremities, they can control everything through the steering wheel. So that is pretty cool. I've only ever seen it done in the VA though. So if it's happening outside of the VA, that's awesome because there's definitely people there's definitely people that need that kind of stuff.
Especially cognitive, trying to get back on the road. It's like, I don't know.
Can OTs also give clearance for people to drive, like
if you're certified?
So everything requires a certification. All right. And PTs can do that as well too. I know in our discussion you said we could.
I mean, I always see OTs doing it, but because I even worked when I did my peds, when I worked in outpatient with peds, it was also at a vision clinic. So they mixed the two. The husband was an ophthalmologist and the wife was an OT. So they did vision therapy, which was pretty cool.
Nice. So guys, you're not limited to just your degree. Think outside the box, okay?
Right.
Be creative. All right?
Multiple streams of income.
Exactly. Although she's telling me to stop.
You got enough streams, Mo. Enough streams.
Because we know rehab world, I mean, it's up and down. There's times you have a lot of patients and then times you don't. So just being flexible.
And being in home health, you get to see so many different things that we ourselves take for granted,
Mm-hmm.
and that you figure out, hey, maybe I can do this to help patients
Mm-hmm.
be able to function better, and that's where the creativity comes in. So,
A lot of the times I see things and I go home and try to throw stuff away because I don't want to be a hoarder. That's one thing I take from home health.
Yeah, there's
Less
definitely
is
some
better. Less
there's
is better.
definitely some some unique situations that you walk into.
Or you just see like why someone just keeps going to the hospital because their respiratory is messed up because they haven't had their vents cleaned in forever, or just discussing that with them, or how they're living or what they're eating, which is the same as doula. You gotta what you're eating, to help grow this baby.
hmm. So you have to take like nutrition courses as well to give advice on that, or no?
I just follow a nutritionist who's also a doula.
Okay.
So yeah,
Streamline it.
exactly. I bought her book, so I'm supportive. Like,
but but yeah, I've definitely learned a lot, Marissa, and thanks for sharing with us. And Alex, there's some things that we could incorporate in our own home health practices to be able
Yeah,
to sell OT.
for sure. I mean, first of all, thank you for taking the time to be with us this evening.
you're
Really
welcome.
appreciate you. Again, expanding our horizons or expanding my horizon because, like I said, I typically just stick to upper extremities and some fine motor stuff. But after today, I've got a little more stuff I can drop in there. But no, seriously though, I mean, obviously we know that OT is a critical part of the rehab team, and especially in home health, because it does take a team to be able to provide the level of care that I think we all strive to provide. We can't one individual do it all as much as we may think we can. There's just some things that some people are better suited for: OT, PT, speech, whatever the case may be.
Right.
But yeah, definitely OT key part of the team, but also all the other stuff that you've got going on and how you're able to tie in the OT to kind of give that complete package. I mean, you mentioned how some people don't know, but I think that the more you stick with it and kind of put it out there and educate
Mm-hmm.
the people, that we're going to have that kind of spread like wildfire to where now it's like, okay, now we got the OTs doing the doula stuff and all the other stuff
Mm-hmm.
that you've mentioned. So very good stuff to hear, for all
Yeah.
OTs, but especially for yourself.
Thank you.
So, do you guys collaborate with PTs like with pelvic? So I am. Oh, she got disconnected, but
Yeah, disconnected or well, that's a good way to end.
yeah,
Thank you to everybody. I think, oh, there she is.
Can you hear me now? Okay.
yeah.
Sorry.
Sorry about that. Yeah.
No, we were just saying again, thank you very much. Really do appreciate you coming out with us.
You
Um
said, do we collaborate with PTs
With
on what?
PTs, in terms of like the pelvic health
I mean, the
courses,
ones I
and
know right now are only PTs, so of course I refer them to my clients.
okay,
Um, because there's not that many OTs that I know that do pelvic health. I have
okay.
to search for them in the DMV area.
hey, you got to start
And
recruiting.
you mentioned something
Exactly.
that I'm really glad to hear, that they're welcoming, they're giving services to people postpartum, the OT and the PT services. So I'm really glad to hear
They're
that. I
starting
know.
that in the hospitals. I haven't heard of them doing it now as far as
Mhm.
in the DMV area, but there are people out there. I think North Carolina is doing it, and Colorado.
Okay, okay. Well, hopefully that will be something we can push in our
Mhm.
area, especially
Mhm.
PG. So, Alex, we have what we're cut up.
We do.
So,
We do. We gotta get
Exactly. I
to it.
mean, because a lot of doctors don't even know what pelvic floor therapy is. So just expanding their knowledge about it so they can refer, and then also trying to have insurance pay for it, because a lot of it's private pay. So if you don't have the money for it, then you're really not going for pelvic floor therapy.
Okay, gotcha. But thank you again, Marissa, and
You're
thank you guys for
welcome.
tuning in and leaving your comments. Share the podcast with a friend. So, and follow us on YouTube, the Alex and Mo podcast. And we'll see you guys back in a few weeks. We know the holidays are coming up, so stay tuned.
Thank
Good
you.
night. Thank you,
Good
everybody.
night. You're welcome. Bye.
I was gonna tell you stay on, Marissa.
Did you end it?
I think I did.